Great, thank you. I want to do a few shout outs for board members that we have in the room. First off, Councilwoman Jerry Schroeder is here, who's an HDA trustee. Jerry, thank you for being here. Also from an HDA trustee, and maybe we can hold applause until I announce all of our board members. We have quite a few here today, and we do appreciate the board support for our organization and our event. Liz Trosper, HDA trustee, Trosper Communications. Stu Hitchin, SH4 Development. Stu, thank you for being here. Wyndham Kimsey, TSK Architects, who does so many of the great projects in our community. James Stein with Southwest Gas, also an HDA trustee. John Stewart with Juliet Companies, HDA trustee. Furthermore, from our board of directors, Bart Patterson is here from Nevada State College, president of Nevada State College. Thank you, Bart. Teresa Conley from Dignity Health, St. Rose, and Teresa is also on our executive board for the Chamber, so thank you, Teresa, for being here. Trish Nash with Signature Gallery of Homes from our board of directors. Also, Chris Larson with PGAL architecture firm, so thank you, Chris. And John Ramos, Harsh Investment Properties. And John, we're going to be welcoming up to our executive board at the Chamber starting on July 1, so we look forward to that. We also have Rick Smith with us from RDS Properties, HDA trustee. Thank you, Rick. James Green from our foundation board is with us, James Green and Associates. Laird Noble Sanders, Lake Mead Boat Storage, and Dr. Kaufman with Roseman University, so appreciate for being here as well. And a couple more electeds. We have Congressman Joe Heck's office represented with Umram Osamela. Umram, there you are, thank you. Such a great support for our small business community as the Congressman's office, so we thank you. Assemblywoman Irene Bustamante Adams from District 42, Chamber endorsed candidate, so appreciate you being here as well. And also so many partners from our City of Henderson, which the Chamber and our HDA work so closely with. Greg Blackburn from the City Manager's Office, Stephanie Garcia-Baus, Mark Levica, others from the city team. We appreciate your support in being here and supporting these projects as well. And John Restrepo, lastly, from our HDA trustees. So I hope I caught everyone and all that. So we appreciate all of our strong board support. So a round of applause, please, for those who did it. Okay, so how we're going to work this today is obviously we're going to have a two-person panel up here, and I'm going to read both our panelists' bios and welcome them up to the stage. They each have a PowerPoint that we're going to go through. Union Village will be the first, followed by PowerPoint on Henderson Hospital. Then we're going to do some Q&A, and then we're going to open it up to the audience as well, so we can get a little interactive on the fly questions and answers from you all. So again, it's a big room. We had a really high turnout. I'm sorry that some of the site corridors aren't the best for the AV presentation. So, but thank you again. Thank you all for being here. So first, I'd like to welcome Craig Johnson up to the stage. Mr. Johnson is co-founder of Union Village. His initial role for this project was strategic planning, where he helped to formulate the integrated health village strategy as well as the wellness village strategy for senior living. Currently, Mr. Johnson and Mr. Holland are in charge of oversight of the construction and development at Union Village, and he has an exemplary background for accomplishing these goals, including 30 years of assisted living management, acquisition, and development, acquired, repositioned, and managed over 40 communities with over 1,400 employees. CFO of a full continuum of care campus in Huntington Beach, California, and the former Vice President of Security Pacific Bank, Mr. Craig Johnson. We appreciate you being here today. Thank you. And then our second panelist, Sam Kaufman, CEO, Managing Partner at Henderson Hospital. Sam's been a longtime friend of the Chamber, and we're excited to welcome him into Henderson proper at Henderson Hospital. He serves as the CEO and Managing Director of Henderson Hospital currently. Desert Springs Hospital is a long-established acute care hospital where Sam is at right now, or is just leaving from. And there he had an emphasis on advanced cardiovascular care and weight loss surgery. And Henderson Hospital is expected to open in the fall of 2016 as a community hospital offering emergency care, surgical services, maternity care, and ancillary services. Sam's career spanned a quarter century, beginning as an assistant head of record processing with the National Institute of Health in 1989, relocating to Las Vegas in 1992, and joining what is now the Valley Health System, which included his current involvement with medical records, medical staff, assistant administrator, and chief operating officer. He was named the CEO of Desert Springs Hospital in 2005 and added Valley Hospital to his portfolio in 2013. So we welcome Sam in coming over and taking over at Henderson Hospital. So at this point, we're going to move forward and turn the microphone, I should say, over to Craig. And he's going to feature Union Village and the PowerPoint therefore. So let me grab the clicker for you up here.
Well, thank you everybody for turning out. I think Sam and I both really appreciate the fact we had such a nice turnout. Anxious to share what's going on at Union Village, both from the hospital standpoint and from the development standpoint. So most of you know that Union Village is the first integrated health village in the United States, in the world. It's master plan that sets it apart. A lot of people have talked about it, but no one's really had the opportunity to master plan a integrated health village before. Had the land, had the timing, had the experience. So we're excited about that. It's a full continuum of care. And by continuum of care meaning there's an acute care hospital to a subacute hospital, also a skilled nursing facility, assisted living, independent living, memory care, in-home care, apartments. You'll see that in a second. But full continuum of care. There's a commitment on all those who partner or all those who are at Union Village to share electronic medical record. That will also be unique and set us apart. It's the largest healthcare project in the United States right now, according to Modern Healthcare magazine. $750 million in phase one. The world's first wellness village. We're really excited about this. It's seniors have never had a village where they focused on wellness. Basically, it's the opposite. Senior care has always been reactive, and when somebody needs more care, they provide more care. But what we're hoping to do is create an environment where we're proactive, where we're keeping people from getting sick, keeping people healthier. Real quick story is my mother was diagnosed 8 years ago now, having to go on dialysis. She was in one of my assisted living buildings, and I immediately she was diagnosed to go on in 4 months, and this was September. So we got her with a physical therapist, and we got her with a dietitian, and we changed her diet, and we put her on an exercise program, and right before Christmas, she went in for her last appointment before she had to go on dialysis, and the doctor said, June, you kind of leveled out. You won't have to go on right now, maybe 6 months. And so we continued, and 6 months later, the doctor said, yeah, it's good news. You're still leveled out. We don't think we have to go on for another 6 months. We avoided that for 7 years with my mom. So just about 6 years ago, she went on dialysis. But 7 years, she avoided being on dialysis. That costs Medicare about $120,000 a year. Plus, it's priceless, having the freedom and flexibility of not having to go in 3 to 4 times a week on dialysis. So that's sort of the genesis of this idea at Union Village. We're working with healthcare plans around the nation actually on this concept, incorporating this wellness concept on their campuses. So we think we have something that will be very unique, and the first one in the world will be here at Union Village. So this is Union Village. This is our master plan as it now sits. The hospital is on the lower part of this, and kind of on the right side. see a little bit more about that in a second. But this is their phases here. So everything in yellow is phase 1. The area in green down here on the bottom left might go into phase 1. It's always been planned as phase 2. And then blue areas are phase 2. Now originally we had 3 phases. And as you see in a second, things have gone so well that we now know that we will only have 2 phases. And it could be very little in that second phase. So the first thing is Henderson Hospital. This is on the lower portion. It's of course the hospital and medical office building going in right now. And I think somebody on the computer is going to need to start that. Yeah, this is a time-lapse photo of the hospital going up, which I think is really cool to watch. Sam was in that last frame. You missed him. So all the land work and then going vertical, and it, most of you saw it went up really fast. Not this fast, but really fast. And this will actually bring you up to speed just a couple days ago. So I think last Sunday is when I downloaded this. So we're very excited about having Henderson Hospital. We view that as the anchor for Union Village. Without the hospital, none of the rest would have been possible. Yeah, they're also building a medical office building. I think it's about 75,000 feet, 80,000 feet, and Sam will get into a little bit more, but it's under construction. That's an elevation of it. And so let's talk about phase 1. So phase 1 is we have we're in escrow with a wonderful apartment builder. They're building, and that section on the right is their site plan. It's a little bit over 400 garden apartments, 3-story walk-up, gorgeous apartments. Be some of the finest in Las Vegas. These are some of the elevations of that, and the site plan for those apartments. I should mention, let's see, behind the great park there on the very north is they're in escrow. We'll be closing that before year end. All of this construction will start by year end, but they're going to build 200 senior apartments is what they're thinking, and that could change. And then to the left of that, on the very back section here, I'm sorry, let me get through that. So in this section, so the very back on the left of the great park and north of that median road that goes through, another 400 unit market rate apartments. So we should have almost 1,000 apartments in the back of Union Village. All that will start this year and begin leasing next year and finishing at either the end of the year or a few months thereafter. So we're very excited about them coming to our project. Again, here's those elevations. And then we have a skilled nursing facility. We're just finishing the negotiations on that right now. It's been a longer process than we hoped, but we were originally going to do 80 units skilled nursing. It looks like we're going to do 140 units. We're very excited about that, and we have the debt and equity all done. So that's all ready to go. It's a build-to-suit leaseback. Then there's a long-term, right next to it will be a long-term acute care hospital. It was originally going to be 28 beds. Now it's 40 beds. So that's exciting too for us too. So that's much bigger than we originally planned. And then we have a dialysis clinic, 14,000 square foot dialysis clinic that will round out that parcel right north of the hospital. Then we have a senior living buildings with Franklin Park. Franklin Park is joint venturing that with Union Village. We have all of our debt and equity done. It will be about 150 units of independent living, be 100 units of assisted living, and 50 units of memory care. Again, this is a wellness village. It's all focused on wellness, and we have some very interesting, unique ideas for that. And that will make some news nationally when we unveil all of our plans for that. This is kind of our first schematic of laying this out. So the independent living is on the left, the memory care in the back, and then the assisted living on the right. And this will be, we're on the promenade, we'll have a walking promenade here with retail on the bottom and residential over it. And so this shows you what we're thinking of the senior living on the independent living building with some of the retail on the bottom and residential on the top. This is a bird's eye view of that. And this is a street view on the promenade on how that would look on the assisted living side. Then we have a wellness village, so our wellness building. So we're going to do a wellness kind of mall, and then we're going to have a dentist office in it. Well, there'll be a spa, massage therapy. There'll be outpatient physical therapy. There'll be a therapy pool. There'll be a fitness center for seniors in it. Retail pharmacy, a whole number of uses. We'll even have Eastern and Western medicine. So it's a place where you can go and get educated on being well, and then any kind of wellness you want to pursue, we're hoping to have in that building be about 50,000 square feet. And we have our debt and equity on that now too. So here are the preliminary elevations on our wellness center. This is from the promenade, looking at it from across, the assisted living looking across, and the independent looking across the promenade at it. It's a bird's eye view of it. And on the promenade, kind of another look at it. This will have a parking garage, have a 3-story parking garage from the get-go. And then we think, an LOI coming in on 2 hotels that will be in this corner. And if we get that in and everything works on that, we will move that up from phase 2 to phase 1. So we think that's a tremendous compliment to what we're doing at the rest of Union Village and the hospital and all the apartments and all the senior living uses. We have a big box retail that has given us an LOI for 10 acres next to, on that parcel there. We can't announce who that is right now, but that probably will be coming out pretty soon. And here's what we're looking at. Oh, and Las Vegas Athletic Club, I didn't put a slide in there, but Las Vegas Athletic Club is just north of that arrow. They've got 10 acres there just north of the arrow, and they're building a 95,000 foot Las Vegas Athletic Club, which should be under construction, we're thinking this year. So this is all we have going. We have Henderson Hospital, we have their medical office building, and then we're doing a wellness center. It's first phase is probably 50. We plan on adding on to that in the future, another 30, so ultimately it'll be 80,000 square feet. We have market rate apartments, 476,400 units. Las Vegas Athletic Club, 95,000 feet. Senior dialysis center, 12,000. Senior living, 180,000 square feet. There'll be 20,000 feet of retail attached to it below it. There'll be a long-term acute care facility, 60,000 feet. Skilled nursing facility, 85,000 square feet. Hotels would be about 100,000 feet. The big box retail would be 100,000 square feet. And then we have the market rate apartments, the second phase and the third phase, all happening pretty rapidly. So we have a couple million square feet, 1,800 units, 750 million in value. So that's Union Village. Give it to Sam.
That's phenomenal, and I think as we look at those timelines. Sorry, and I moved down here. I didn't want to get feedback up there again. So the timeline is what's especially exciting, I think, to the business community and what we may see happen there in really what I would call a short period of time. So we thank you, Craig, for that vision. Sam Kaufman. So Sam's current responsibilities include the management and construction oversight of the new hospital, with a particular emphasis on strategic planning, business development, physician relations, and value-based purchasing expectations, along with finance, human resources, and daily operations. So Sam's going to do it all at Henderson Hospital and oversee it all. So I think now we'll move on to his PowerPoint with the team behind me. So
actually, it is a team effort. It's definitely not Sam Kaufman, but wow. First thing I just want to say is wow, what a turnout. I'm honored to be representing Henderson Hospital today, and if this is the type of support that our project is going to see, I guess we need to dust off the business plan for the expansion, Ryan, so get that going, please, because I think we're going to be very crowded. So a little bit about the Valley Health System. The Valley Health System currently has 5 hospitals located throughout the Las Vegas Valley. As you can see, Centennial, Desert Springs, Spring Valley, Summerlin, and then Valley Hospital, which was the first hospital that was built in our system. Ta-da! Number 6, so Henderson Hospital. It's our first entree into the city of Henderson, our 6th hospital, and our date of opening is slated for October 31st, which is Halloween or Nevada Day, whichever one you prefer. I will not be in costume. But as you can see, the Valley Health System now has acute care settings in all parts of the community, and we're extremely excited to be in the Henderson community. So looking at this is a rendition of what the hospital will look like, and it looks pretty close to what it is looking like. Our partners of SR being here today, Joe Garcia, the senior project manager, him and his team have done a phenomenal team working in conjunction with Turner Construction, HMC Architects. They are building us a beautiful hospital. So this has been going on now for 3 years, very exciting project, and we're extremely excited. We think we'll employ approximately 600 to 700 people once fully open, and then we'll expand staff as we need to based on service lines and as we expand beds and build additional expansions. As was stated earlier, we are going to build an 80,000 square foot medical office building adjacent. We've actually started construction as of right now. About a month ago we started construction. That'll be a 4-story tower, which will also house an ambulatory surgery center on the first floor. That'll be about 15,000 square feet. We'll hopefully also add a wound care center on the first floor. And the ASC opening will hopefully be in June, July, August of 2017. So various quotes from our dignitaries. The governor, extremely excited about the venture. Mayor Hafen has just been so supportive, along with the rest of the Las Vegas City Council, Councilwoman Schroeder. Henderson, I'm sorry, forgive me. I've only lived here for 25 years, but the City Council has been phenomenal. They've been great partners, and they've really made us feel like family from the beginning. And just working with them has just been a pleasure. So as you can see, some of our dignitary comments. Primary objectives, of course, the first thing, increase access to the residents of Henderson. Healthcare is a big issue across the whole country. Las Vegas and Henderson are no different, so having additional access is going to be very important for the hospital. The second, of course, it all starts with quality and safety and patient satisfaction. And we think this will be a differentiating item at Henderson Hospital. We're designing the hospital with a few differentiating items for quality and safety, like white lights in our OR that will kill bacteria, along with in the emergency room. Multiple fall prevention items that we don't see in other hospitals in the Valley Health System. Quiet settings, so we're trying to create this quiet hospital, so quiet HVAC units. Not a lot of overhead paging like you might see at some of the other hospitals. Some technology, handheld technology that our nurses and clinicians will be carrying to help them with texting and phone calls from doctors, and no longer calling this one to call this one to call this one. The doctor will be on the phone with the nurse directly. So we're putting technology in the hospital. We'll be the first hospital to have this technology throughout. So very excited about that. As Craig stated earlier, we're the anchor tenant for Union Village, and they've been great partners. Craig, David, and Gary have been phenomenal partners for us, so we're very excited about that. And then, of course, number 4 is developing collaborative relationships with our key physician partners to offer the best care for our patients. Building a beautiful hospital is one thing, but you got to have the collaboration with our physicians. So this is what we started with. Not as pretty as the slide that Craig showed us. Yes, it's a swamp. It was pretty ugly. It was very ugly. So the first thing we had to do was level and grade and put a lot of dirt in. So if you're talking about filling the hole, we had to bring in 289,000 cubic yards of dirt. Now, Joe, I'm sure, can tell us exactly how many dump trucks that is. I don't know if it's 20 or 30,000 dump trucks full of dirt, but it was a heck of a lot. And taking a look at Quest Field, the first level of Quest Field, that's how much dirt we had to bring into the hospital to level it off and make it pretty before we even started to put anything in the ground. So our service areas, as you can see, this is our primary and secondary service area. We're located at 95 in Galleria, so very good access for the community, and we're hoping to attract patients from the southeastern part of the community of Henderson, along with Las Vegas. The geographic location will also be very ingratiating to our partners in Lake Las Vegas, Tuscany, Boulder City, along with the new master plan community coming on board of Cadence. And we think that Henderson Hospital will be a very good selling point for housing projects and businesses looking to relocate to our great city, because now we'll have additional health care in that part of town. The location of the hospital will also give EMS an alternative and more access to bring patients. Ambulances are always looking for hospitals. There's always waits, as you hear, hospitals on divert, not enough access, and ambulances have to travel from hospital to hospital, and then patients have to wait. We're hoping to alleviate some of that wait as well. Now it gets interesting. So this is how the hospital stacks up. First floor is going to be the emergency room. 28-bay ED with 5 observation units and 12 rapid areas, 6 psych areas, 4 ORs to start, a GI lab, and then a cath lab specials lab. Moving on to the second floor, we have a 32-bed ICU and a 30-bed IMC, but those beds can flip-flop into med-surg or IMC. They can go both ways, which is very nice, and we can increase or decrease beds and capacity as our acuity level rises. The third floor, on the east side, we'll have 32 med-surg beds that are built out, and then on the west side, we'll have 30 beds of med-surg that will be shelved, and like I said earlier, hopefully we'll be putting the business plan in to get those built soon. And then the fourth floor, as I call it, the penthouse, I promise this to the OB community. We will be having women's services, so we will have a 28-bed postpartum unit on the east side, and then on the west side, we'll have a 2 C-section suites, 8 LDRPs, and then ultimately we'll open up a level 2 NICU, which will go to a level 3 NICU. The NICU probably won't open up for at least a year after the hospital opening. So these are our service lines. Women's services will be key service lines for us, labor and delivery, GYN, and then NICU, as I mentioned. Surgical services, you can see the services we're looking at: general, breast, ortho, spine, urology, ENT. Cardiology, as I mentioned, the cath lab will have diagnostic capabilities for both coronary and peripheral. Radiology, very similar for diagnostic and interventional as well. Endo, a very, very good emergency room, state-of-the-art emergency room, along with wound care and an ASC in the future. Just a few pictures. These are actually outdated. They were taken a month ago, but because, as you saw Craig's animation, the hospital's going up so quick. So these are very outdated pictures, and actually it's almost done. According to our friends from SR, we are going to be done June 30th with the interior construction. So I want to show you what it's going to look like. There should be music with this, but that's okay. It's not me singing. So this is an animation of what the hospital will look like exactly. Same finishes, same colors, very modern, very pretty, a nice new shiny penny for our community. Going into the emergency room. It's amazing what they can do with technology nowadays. You would think we shot this. So this is the operating rooms, 625 square foot operating rooms. They're huge, high technology. Lots of things can go in there. A lot of things will be in the ceiling, so there's going to be a lot of space for a lot of high acuity type cases. All of our rooms are single patient rooms, so no semi-private rooms. First time in my career, so I'm very excited about this. This is just an example of our postpartum suite. So we're very excited about the hospital. So moving on very briefly, I sit in front of you representing Henderson Hospital, but it's definitely not about me, it's about a team. And it started with a great lady who's not here today, Carla Perez, who's my boss. I've known Carla for 25 years. She's the regional vice president for UHS in Nevada. And then we have a very, very competent C-suite. Ryan Moon, Tina Coker, and Diane Gregory actually at table 1 today representing Henderson Hospital. You can't do anything, like I said, without competent physicians. So we've got great chief of staff, great chief of surgery, chief of OB, very excited about starting at the hospital. And then we have a great department team. Jody Koopman is here and Colleen Murphy representing the emergency room med surg. So it takes a great team to make this hospital work. It's going to be pretty, it's going to be nice, but it's really going to be about the people that differentiate Henderson Hospital from everybody else. And that's it.
Great. Thank you, Sam. Round of applause, please. So, Sam, when we think of emergency room services and trauma, if you will, in common terms, what level of trauma center will we expect to see at Henderson Hospital?
Well, we will not have a designation for trauma. So you have level 1, level 2, and level 3 trauma. We will not have a trauma designation at Henderson Hospital. Possibly something to look at in the future, but coming out of the chute, we will have a very, very high-end technology emergency room that will be able to handle a myriad of issues, but trauma will not be one of them at this time.
Okay, understood. So maybe a question for both of you that you can answer. We're bringing in this new hospital online. We're developing a medical complex around it. What has been the reception in the medical community as far as interested physicians and parties that can be involved in the project?
The physicians in the community are very excited. One of the things we're looking at, there's a lot of physician excitement about relocating from the Northwest and the West over to putting offices in the Henderson market for their East Side patients. So right now, a lot of the patients travel from the East Side to the West Side, which is a half hour, 40 minutes on any given day, back and forth. But with Henderson Hospital opening up, there are a lot of physicians that are interested in our MOB and relocating close to the hospital and putting a secondary office. So we're starting to see different specialties coming onto this market, along with physicians that have interactions in the Northwest and the West. So a lot of excitement with the physician community.
Greg, anything to add on that?
Yeah, we don't deal directly with physicians that much, but I can tell you we've had a lot of interest from out-of-state healthcare agencies who are looking at Union Village as an opportunity to come into Nevada and bring in some specialty services that would be really beneficial here in Las Vegas. And we're excited about the contacts we've had, and hopefully in the next 4 to 6 months have some announcements to be made on that behalf.
Okay, very good. Sam, maybe back to you in regards to hiring for the hospital, and I know this is something Tina has had to be a big part of as well, but how's the market been, and how many people need to come from out of state to be a part of it?
Well, we just started, so we hired the C-suite and the department directors a few months ago. So we've hired all of our department directors for the most part, except for one. Now we've started to post for the staff positions, so nurses, CNAs, techs, clinical and ancillary support staff. So we started posting within the Valley Health System about a month ago, and we started our interview process. We're actually hiring people left and right. We're interviewing on a daily basis, and now we post it externally in the Las Vegas and Henderson community. There's a lot of applications being posted onto the site right now. So right now, I don't know if we'll have to go outside the state, outside the city. That would be a good problem to have, to just keep the jobs for the people inside the city of Las Vegas and the city of Henderson. That would be terrific. But we're optimistic that we're going to be able to staff the hospital. I mean, it's in a beautiful location. There's a lot of people that live that work in the northwest and west part of town that live in Henderson that I think like the idea of working near where they live. So I think there's a lot of excitement there. The Valley Health System, there's a lot of excitement within our hospitals for some of the people that may want to move. And then we're seeing external applications, a lot of external applications from the other facilities in town.
Great, very good. So technology, you touched on some of the technology and what will be new in the hospital, new and different that sets it apart. And I know for the Union Village concept as well, technology has been a big part of it to be on the cutting edge. Could you each maybe speak to some of those highlights beyond what you talked about in your PowerPoints as far as what will be the emphasis?
Yeah. So one of the considerations if someone comes into Union Village, you have to be committed to go into a electronic medical record that can be shared in the system. So typically, probably some of you have had it. You go from a primary care to a specialist, and you've got to You got to sit down and fill out all these forms. Again, all those will be transmitted and populated in their database. So those won't have to happen. The nursing notes from the assisted living will go into the medical record, electronic medical record. So we're committed to a common electronic medical record, and we made a lot of progress on that in the last 6 months. In addition to that, we at Union Village are working on a lot of smartphone apps, a lot of programs that give people access to wellness and to healthcare. So you can get on and do telemedicine from your room. You can get into information databases. You can assist in accessibility into the healthcare system. And then the social side, things like notifying our residents of activities, of transportation, on and off site activities, on and off site. On the wellness side, of communicating with your wellness coach, communicating your progress and your wellness plan, and then also on the education that's a part of the wellness plan. There'll be a ton of educational seminars and things at Union Village, and so informing our residents and people off site too of what's going on there, allowing them to kind of plug into what we're doing. So we're excited about the technology side.
For the hospital, I did mention, I touched on a few things. When we built the hospital, before we even had drawings from HMC, we put together user groups within the Valley Health System. So imagine all surgery, emergency room, pharmacy, every clinical ancillary group getting together and coming up with all of the things that are going wrong in their hospitals. And they would like to see change to make it a better place for their employees, a safer place for patients, and higher quality. That's kind of what we did, and we mocked up the hospital with styrofoam, believe it or not, and we used Centennial, our partner up in the Northwest, and they put a whole floor together, and we mocked up OR rooms, we mocked up ED rooms, patient rooms, ICU, and a lot of things that we did were based on that, and that gave the architects a really good understanding of what we were looking for. So we want to try and create we want to remove the barriers that some of our other hospitals that they have over time and built the perfect hospital. Not that we can do that, but we're trying. So some of the technology that we're putting in there, I mentioned the bacteria killing white lights. So a lot of hospitals have lights where they move them from room to room to room. In our ORs, the actual technology is in the ceiling. In our ORs, in our ED, and our cath lab. So this is technology that will kill the bacteria, whether it's MRSA or Acinetobacter or other types of bacteria that get into our patients, which keeps them in our hospitals longer, or even untoward events. Patient satisfaction is going to be a huge emphasis in our hospital. It's a huge emphasis in any hospital. For us, we think it's going to be a differentiating item. Not only are we having the handheld phones that I mentioned earlier, but we are going to have a room service for our dietary, for our patients. That will have room service, that they'll be able to pick up the phone. No more menus. They'll pick up the phone, and they'll, if it's on their diet, they can eat it. So we're trying to make it more of a satisfying environment for our patients. So a lot of different things to increase satisfaction, decrease zero harm. So it's always a hospital's goal to have zero harm. We hope out of the chute we'll have zero harm. So we just have to keep it that way. Tina and her team will have to do that.
Great, thank you. You both had alluded to maybe the next building in the project, next construction will be an office building by UHS. Maybe you could touch on a bit of that and what will be offered out of that.
Sure. So we have a 4-story, 80,000 square foot office building being erected as we speak. And we're already in the process of leasing out and signing letters of intent with physicians in the community. So that will continue to go. Hopefully that building will be operational by January 1st or so. Pretty close, Joe? Okay. I will hold you to it. But also in that first floor I mentioned an ambulatory surgery care center, which will hopefully be in the second quarter of 2017. And then we'll be able to grow the hospital. I mentioned the 30 shelf beds on the 3rd floor. And then we actually have space that we can build additional towers and erect additional towers, build out more surgery, more ED space as volume dictates. So those can all be done in the way that the architects put the hospital together with minimal disruption to the hospital. So we can be building a patient tower and not shut down anything in the hospital. And we're hoping to be there in the upcoming years.
Okay, very good. Maybe Craig, I know your last slide there showed the scale of projects in the pipeline, but I guess maybe most short term, what's the next thing you see coming out of the ground for Union Village?
Yeah, the apartments should be coming out of the ground by year end. I think Las Vegas Athletic Club should be coming out of the ground. And I did mention, I probably should have mentioned that I had the opportunity to go to the Netherlands, and there's an Alzheimer facility in the Netherlands, very special. I've been studying this for about 5 years, and I had never seen it. And we wanted to integrate some of the technology and some of the thought process that they use here at Union Village. And we're happy to announce that we are going to be doing it. It's in the Netherlands, it's called Dementia Village. And it's been on CNN and ABC and 60 Minutes. I mean, it's really unique. Basically what they do is, in Alzheimer facilities today, if anyone's ever been in one, and I've been in hundreds of them, you walk out of your room and you walk into a very sterile environment. It's very much like a hospital. You don't quite know because you have dementia while you're there. You don't know. And you don't know if it's a hospital or a psych hospital, but you know it's bad. It's really hospital-like sanitary. Everyone wears smocks, nursing smocks, and these guys took a whole different direction. They took their 3-story Alzheimer facility and they pushed it down, and they built a village. And so it starts with a little housing unit. Housing unit in their model is 6 bedrooms around a living room and a kitchen. And they come out into what they think is their house. It seems like their house. And they've got different models. They have some Asian population. They have an Asian model. If you're an Asian family, you'd be very comfortable. There's a country kind of living model, and then there's an urban model. So if you live downtown Amsterdam, it's something you'd be comfortable with, kind of a typical house. But you walk out of there into a village, and there's a grocery store, there's a cafe, there's a barber shop, there's a town hall, the music shop, music store, there's a bar. I mean, it's crazy. But and everyone is not dressed in smocks. They're dressed in. There'd be a waitress dressed as a waitress, and there's the landscapers are dressed as landscapers, and the market. The lady that works the market dresses as she would if she was in the supermarket down here. The difference is they're all caregivers. They're all trained caregivers, and they're all there to take care of these people, but they want them to feel less anxiety. They don't want them to feel like they're in a medical facility. They want them to feel like they're in this little village that's very comfortable to them. And we're going to be doing that at Union Village. And it will be the first it'll also be the first in the nation. And that in and itself will get a lot of press. And we're very excited about bringing that to Henderson. And then we have plans to take that other places around the United States.
Great. I'm going to just ask one more question, and then the plan is to open it up to the audience for a little Q&A as well. So years ago, you said Henderson. You selected Henderson. Union Village did as the place to imagine this project. As we look upon our community right now, and we look at some of the challenges and possible voids in our medical sector, how do you view Union Village, and in turn, maybe some of the services that you'll be offering at Henderson Hospital, Sam? How is that going to fit into maybe the medical tourism sector, the economic diversification and development sector that we so desperately need?
All right, so I'll start with that. I think that, so I come from California and have a lot of friends in businesses in California. Everyone I know who has a company in California has thought about coming to Nevada. Tax basis is low. Housing is a lot lower, especially than Orange County, Newport Beach. And so you can create something. Your employees can get more value for their money. They can have more money in their pocket. It's just a huge win. Healthcare is a major issue with these companies. As some of you know, and if you've heard us share about this, but according to the Commonwealth study, just a few years ago, Nevada is 47th in healthcare out of 50. That's why Governor Sandoval when he came into office 6 years ago, he made healthcare such a huge priority for 2 reasons. One, to create great jobs, and 2, they're going to help lift Nevada and bring in other businesses when healthcare gets on the rise. And that's why we're here in Nevada. We're here in Nevada because we saw it as an opportunity to come in and build a campus because there's a need for beds. And there's no better place in the United States to move the dial on creating a better environment for the people of Las Vegas, certainly. So we're very excited about that. I think this is huge for Nevada, huge for Las Vegas on moving that needle, as I've said. You know, already, I mentioned to you, we've had at least 20 calls from specialty clinics around the incredibly good centers of excellence where they see the ability to come in Union Village and create an environment and do medical tourism, you know, plus take care of some of the voids in the market. But clearly, if everybody's agreed with this, if there's an area in the United States that can support medical tourism, or that it could work, it's here. It's here because it's centrally located, because you can come in here for a spouse surgery, for instance, and then have plenty to do, incredible environment, you know, a place to hang out, all kinds of things to do. So this is the right place. And I think Union Village will be out of the right place to do medical tourism, will be the place to do it because of the integration, because of all the housing and opportunities there, and the hotel and the senior living, and I just see it as really being able to build on that whole theme. And you know, at the end of the day, I kind of wish we had another 30, 40 acres, but I think what will happen is around Union Village we'll see a lot of that growth. When we run out of space.
I think that the geographic location of Henderson Hospital really sets up well for medical tourism, especially with the partnership with Union Village and the integration that's going to be taking place. We've looked at certain service lines, we've talked with various physicians, and there are certain service lines that set up very well for medical tourism. And considering where the location of the hospital is, 12 minutes away from McCarran by car, 4 hours from California. It's an ideal location to bring in medical tourism into this city. Also, as I had mentioned earlier, the first two things that people are looking for, whether it's businesses that are looking to relocate or housing developments that are looking to start up, they're looking for healthcare and education. We will hopefully help one of those out. We won't be able to help the other out unless it's medical education, which is something that we will probably be doing in the future as well for our GME people in the room. But so I think the hospital will set up well for the economy, for helping the city of Henderson, and that's what we want to do. We want to partner with the city and with the community, because it's a great city. I've lived in the city of Henderson since I moved here in 1991, and I can't see living anywhere else, so we're excited.
Great, thank you. Go ahead, Craig.
Yeah, I might mention, I don't know if anyone knows this, but I, in fact, last week when I was here, I drove the site, and the city, for those of you who know, has done a great thing. The frontage road to Union Village, right on the freeway, is called Stufflebeam. And Stufflebeam dead end, it was a dead end into the church. And the city has bought some land, and they've taken that and created a drive right onto Stephanie. So if you're coming to our site from north or west, you have the option of coming up Stephanie, over the freeway, and then down right into Stufflebeam, right into our site. And so for medical tourism, especially coming up Russell Road, we're right at Russell Road with a really great way to get into the site now. So that was a wonderful thing the city has done for us.
Great. And maybe just one more question is working with the city, great experience, good experience, some challenges. So you want to talk a little bit about that from a development standpoint, because we do have so many of our construction and developers out in the audience here.
Yeah, for Union Village, we've had the most incredible experience with the city of Henderson. They've been supportive, fantastic, fair, always had the customer service at the city is like a great company. I've just never experienced anything like it, and I tell you, from top down, we have had a fantastic experience with the city of Henderson.
I definitely echo that. They've been extremely collaborative, ingratiating us in as family, treating us basically like family. And when we told them that we were going to name the hospital after their great city, I think they were very touched. So it says a lot that we're naming the hospital after our great city, Henderson Hospital.
Great, thank you for that. And thank you to the city of Henderson as well. So, okay, we want to open it up to a few questions. And I will do this by a show of hand. that we can signal you out. And so if you have a question, I can call you out. So DeAndre with Barclay card. Go ahead, DeAndre.
With all the learning opportunities with Roseman and Oral Clinic and also CSN, can you tell us about some of those collaborations, if any, with Henderson Hospital?
And so the question is how is the project going to collaborate with Roseman or Toro or some of the higher ed partners that we have?
So before we're not going to have GME yet because the hospital's not open yet, but we actually have already started collaboration with Toro, with Roseman, and meeting with UNLV as well. So we hope to partner with all three of the medical schools in town to provide GME within the Valley Health System. Henderson Hospital, at some point in that process, will also have residents working at the hospital and learning their trade. We'll also be working with medical students from those medical schools as well, third year and fourth year students probably at some point. I would say give us 6 months to a year once we get the kinks out, and we'll be working with them. But an excellent opportunity for GME. I sit on the governor's task force for GME, so I definitely support more GME in this state, and we definitely need more doctors to keep our doctors in the state. So I think we have an excellent opportunity. We're building a 300 resident program in the Valley Health System, and those residents will be dispersed throughout the Valley Health System, Henderson being a part of that in a couple of years.
Other questions? That was easy, everyone. Come on. So I'll back over here. Way over there. Okay. You got a loud voice? All right. Do it. Will Union Village be pet friendly?
Yeah, the answer is yes, or my wife would kill me. So it's totally pet friendly.
So, and maybe I'll come right back there. One question in regards to maybe the legislative process. Sam, you're very involved with Jimmy. The chamber has very active issues in the legislative team. What's the number one priority as you look out over the coming legislative session where you'd like to see some movement happen that the community could get behind and support? Because we do have so many other of our hospital partners in the room here today as well.
I think GME is definitely a very important one, and the governor has definitely seen fit to develop the task force. Psychiatric care in the community is a huge component, and the governor, once again, has seen fit to develop a psychiatric task force, and we're starting to see more and more psychiatric access. Bringing competent, qualified staff to the state of Nevada is very important. Not only physicians, but nurses and other clinical ancillary, I think, are hugely important. And let's not discount reimbursement for Medicaid. That's always going to be an ongoing issue for all of our healthcare facilities, whether it's hospitals, whether it's clinical ancillary, whether it's physicians. We need to make sure that we keep up with the vast expense of technology to take care of patients, and Medicaid expansion is very important.
Good, very good. Question in the back?
Yes, wasn't there going to be a Henderson Museum of Science and Space located on that side at one point?
Question was there still plans for a Henderson Space and Science Center within Union Village?
Yeah, we've reserved 5 acres at Union Village for the Space and Science Center, and I'm not quite sure when that option. They have to. There's a time period that they've got to agree to come on, and that we have not heard anything from them or the city on that. So don't know where that stands.
A recession-challenged project, I think, to be sure, that would be a noteworthy one. Other questions? So, yes? So the question was, is it privately funded, or was there any state or federal funds towards the assisted living portion of the project?
Yeah, great question. So there is no, for the senior living, for the skilled nursing, and for the long-term acute care hospital, there is no public funding on that. So it's all private funding. We probably will have an announcement on who our partners are on that in the next few weeks. But to answer your question on the senior living, there will be no there's no mechanism for
government assistance. But on the skilled nursing and the LTAC, there always is. It's all integral into the healthcare delivery system. So whether it's Medicare or Medicaid, all of those patients will be cared for in those facilities.
Okay, and last question right here.
Yeah, so there is, we've had extensive market studies, and there's a tremendous need in Las Vegas for memory care. There has been, and when you look at the numbers, I mean, it's catastrophic what's going to happen in the next 15, 20 years with memory care growth of beds needed. It's what's happened, of course, is people are living longer. We saw dementia 40 years ago, 50 years ago, but it wasn't very, we didn't see a lot of it, but people were not living this long, so people are living a lot longer, and because of that, it's a disease that really you see in the 80s, in people in their 80s, and so I've had 1,000 Alzheimer memory care beds, and my dad got Alzheimer's 2 years ago. Had to go in one of my facilities, and it's so I've experienced it intellectually, I've experienced from the management side, and I've now unfortunately experienced it from a personal side, and it's a devastating thing, and unfortunately the numbers are just going through the roof, skyrocket of what we're going to need, not only here but throughout the United States. Big need here right now though.
Thank you, Craig. Okay, Sam Kaufman, Henderson Hospital, Craig Johnson, Union Village. A round of applause, please. And that does conclude our program. As always with the Henderson Chamber, we like to finish on time.